Okay, so welcome to our third Rural Reimagined Club meeting of the semester. Thank you all so much for coming here. I know it's all the sharing about this meeting has been very short notice, and it's become a very busy semester for everyone, but I'm very glad that you are all here to definitely grow in that advocacy and awareness for rural communities. So we have a lot of exciting, great updates for y'all. So let me continue. Okay, so the first question I have for everyone is, what is the best way of communicating with you all? Because I know that it's very hard to sometimes keep track of like many emails. So we wanted to know whether you are all interested in possibly creating a group message or having a Teams or any other ideas you may have. So would anyone like to just chip in, just speak up and say what you think about maybe having a group me or Discord or something?
The group me sounds good to me.
I'm definitely for a group me. Anyone else like to pitch in? Or
I was also thinking the group me was the best idea.
Yeah, Kester, I will be in concert with everyone too. When my students are doing a major group project, group me seems to be the most perfect thing. And then, but also sending the official emails out so that there is an actual record of what's happening. I would still send those out, but with those nice communications and getting some actual projects done, I think the group me will work well.
Right. So I think we'll start setting up the group me soon. So if you want to individually message me here with your number, if you're here on this meeting right now, you can individually message me your number, and I will like write it down and create the initial group me, and then send out an email if that works for anyone who's not on, if that works for everyone. Because I know trying to track down a lot of people is a little bit hard, especially, but I think that may be the best way. How does that sound for everybody?
Not a problem. Do you still have my number, Kester?
Yes, I do. I do have your
Awesome.
number, Jose. So definitely. So I will definitely, once I get through this PowerPoint and turn it over to our guest speakers, I will start collecting the numbers and getting them into a group me. So awesome, guys. So thank you so much for that. We wanted to make sure that we know that it's hard to communicate with everyone, especially through emails. So definitely, we're very glad that you all want to create a Discord. So another big update is we're still needing students to help with the book club. And as a quick recap, you'll be helped with by Dr. McQuail, Jordan, and some other rugby residence workers. You will be selecting the book club discussion and questions. You'll help promote rugby. And this is not just one we're not just looking for just one person to help head it. Even if you're interested in participating, we want, as many students as we can to help co-lead. So we just wanted to ask you all, is there anyone who's on the call right now who's interested in potentially helping lead this project? I know Dr. McQuail's on. Dr. McQuail, are you on the call as well?
Yeah, I'm here.
Great. So, okay, awesome. So is anyone interested in the project right now, or may know of anybody who may be interested?
All right, Kester, you're thinking for next semester at this point, right?
Right. Yes, because I think that this semester it may be best to have, I guess, plan it out this semester, and then we could lead it on into whoever is leading it would definitely implement it next semester.
Yeah.
Okay, well, if anyone has any ideas of anyone who may be interested in helping lead this, please just let me or Dr. McQuail know. And we're still, and even if you're just interested in being a part of it, right? Even if it's not maybe leading it, but just taking part, just please let us know, and we'd be happy to get in touch with you and to help get this book club started. So, any questions about that before we move on? Any comments? Okay. Okay, so another announcement is that we are going to be having t-shirts. So last year we had one of our members, she's not on the call right now, but Bailey Hooper, I think she's a junior accounting major, and she designed these wonderful t-shirts for the club, and we are in the process of finding a vendor and determining costs. And actually, Michael Gray, could you speak a little bit more about the t-shirts, since you're kind of in charge of all that, of the sponsors and stuff like that?
So right now, the cheapest vendor we have found for our small size t-shirt order is going to be around $15 a piece. And so we're going to send out a Google form in the GroupMe. So whoever's interested can sign up, let us know, so we can have a general idea on how many shirts to order. We're also looking at doing some fundraisers and looking for sponsorships. So hopefully we can reduce the cost for students to purchase a shirt. Since we're a new club, it'd be good to get these shirts so we can let people know we're on campus, we're active, and just get the word out there. That's it from me.
There's a thing called Sticker Mule that I've looked into, and roughly about 100 stickers is less than $1 there, and you can actually upload your own design, just as an idea that may be useful.
We've actually done Sticker Mule. So we have these little Gen R stickers. I have a few in my portfolio with me, but we've actually done that. So if anyone has any ideas for vendors or anyone who may be interested in helping us financially support the club, just please let us know, because we're always looking for because especially as we try to do service projects, we'll start having incurring costs. So we really need as much financial support as possible. So if you have any ideas regarding that, just please let us know.
Have you guys applied for the 606 or the SMAC funding?
No, Dr. Geist, we've applied for solo funds for the freebies that we've given out during our giveaways, but I don't think not yet about the 606 or SMAC yet.
I don't know. Jeremy, do you know if they're still doing that this year, or were those suspended? Or
I thought they were suspended,
Okay.
but I'd have to reach out to Michael or Ed and confirm that.
Okay. Yeah. I mean, I know student clubs in the past have been able to access those funds for things like if you were traveling someplace for a service project or those kinds of things. So, that's definitely something to look into. And I've applied for those funds before, so I can help you guys through the process. Have you applied for those funds, Jeremy?
No, because they weren't available this semester for sure. Like I know that.
Yeah.
It's like the little project we recently did in rugby. There was no funding just for mileage or anything.
Okay.
But I don't know about next semester.
Yeah. Okay. Yeah. I think
but
it comes through student affairs.
It is. And I think my perspective too this year has been brainstorming for next year.
Yeah.
So even if the funding isn't available right now, that doesn't mean we still don't prep it for when it opens up next year.
That's a good idea too.
Right. And we'll definitely ask Jerry about it too in the Grand Challenge Committee meeting later this afternoon. So, because I know me and Cheyenne Newby have some questions regarding another quick news update. We're also going to be working with the Psychology and Psychi Club soon regarding if the potential opportunity to help out with one of their events with Mothers of Mercy. They're an organization that helps parents who have struggled with like addictions and stuff, who are trying to reclaim their identity as mothers and fathers, to help like in the local community to help them through that. So we're definitely looking forward to working with them soon this semester, but there's some questions going on. So more about that at our next meeting. But definitely, okay, so here's another opportunity for all of y'all, and I need students to help out with this. So Dr. Julie C. Baker, she's the Associate Dean of Education, is looking for students especially within the Rural Reimagined Club, to record a radio interview sometime later this month. I can say from personal experience that a radio interview is not as bad as you think it is, because it's not live, it's like pre-recorded. You won't see anybody. So if you're kind of have a little bit of stage fright, it's not as, it's very fun, and you won't feel like you're in front of a lot of people. So we need a few students to take part in this, and even if they're not within the club, but they still would be a great fit or are very passionate about this, please reach out to them. So the goals are to spotlight on what tech students have to say about the impact of rural educators on their lives. So if you're especially from a rural area, or you know rural educators, we would love to have you on board, and we want to highlight what the club itself is planning and working on to promote awareness regarding the importance of rural educators. So why are these rural educators important? Since the goal of the whole PSA was to inspire students in rural areas to come back as teaching, to come back and hopefully teach in their communities, so that way, because many rural communities face drastic teacher shortages. So definitely, is there anyone interested right now? Because I do need I told Dr. Baker that I would send her a few names by tonight. So is anyone interested right now in being a part of this interview? And she'll help plan and coordinate a date sometime in the next few weeks.
Yeah, I'm definitely interested. I come from an extremely small rural area, so that would be awesome to speak. I actually got to speak about that yesterday with the third party president candidate, Joe Jorgensen, at her rally. So that would be awesome to speak about.
Great, definitely. I just wrote your name down, Brandon. Is anyone else interested in speaking about this?
Kester, you can put my name down if she wants someone other than a student. I would rather the students talk, but I could talk all day on that topic. So just let her know if she needs me.
Right, I will do that. Same with me. I could talk all day about, rural teachers. They're some of the great rural STEM teachers, especially some of the greatest people you ever meet. So anyone else interested? I think Kaylee and Brennan are on this call. Are either of you interested in taking part?
I was just about to say, I don't want to make a definite commitment right now, but that does seem like something I'd want to get involved with.
For sure. And this is definitely a great thing to, don't do it because you want to put something on your resume, but it's a great thing to put on your resume that, as part of the club, you did this radio interview that will help, that helps promote teaching careers and students, because that shows not only your communication skills, you're service oriented, you're aware of like the relevant issues pressing. So it's a great way to share that you've been, helping promote this advocacy in rural areas. So anyone else interested before I move on to our next slide?
Hey, Kester, none of us can see the PowerPoint.
Oh, did I think I accidentally might have unshared it. So, okay, let me reshare this. Okay, can everyone see that now?
Yes.
Okay. Really sorry about that, everybody. Okay.
Chester, can you hear me?
Yes, I can hear you, Sarah.
I just wanted to say I might potentially be interested in being involved in the radio interview. Crossville is kind of like a moderately rural area, but I do feel like I might have some things to say like on the topic because it is important.
For sure. Definitely. And Dr. Baker is going to coordinate with dates. So even if you're interested, if you can't come, that's okay. I know it's very hard to get a bunch of different people with very different schedules to like come together. So if we have just a few people, like maybe at least 2, 3, 4, go, that'd be very awesome. So anyone else interested?
Kester,
yes, Dr. Geist? Oh, yes, Dr. McQuail.
As a Tennessee Education Association leader, I would be willing to participate, and I could probably find like a teacher speaker if you want. Somebody from Baxter comes to mind. and James Akinson might be willing to do it too at Tech. But again, like Jeremy said, it'd be better to have students participate. But I've got some swag from TEA I can hand out to you. All right, thanks.
Well, thank you. And I know Dr. Blair, have you? Maybe later we can. But if a lot of Dr. Blair students have been volunteering a lot of their time to art education students to basically teach art to Baxter Elementary students, which is awesome. So it just shows what a lot of our students are doing through Rural Reimagined to help impact those rural schools especially. So just wanted to let you all know about that. Okay, so if you didn't see the t-shirts, I think if my slide wasn't, so here's what the t-shirts look like if I accidentally did not share my screen then, but so we're gonna get those made, and so we'll send out a Google form, everything later. So okay, so I think the last point of topic is the Rural Journey Speaker Series. So we had our first ever session a couple of weeks ago with Becky Magura, president of WCTE, and Dawson Davidson, one of our very own members, who unfortunately cannot be on the call right now, but it was a very exciting speaker session. I know I had a lot of fun moderating it, and if you missed it, you can watch it on our YouTube page. If you just look up Rural Reimagined on YouTube, you'll be able to find it, and we'll get that posted up on our Rural Reimagined student page soon. So, and we'll share it out with we shared it out in our last email, and so our upcoming Rural Journey Speaker Series, and this is the beautiful graphic that Sarah made, is going to focus a lot on STEAM education. So if you're not from Cookeville, Prescott South Middle and Elementary Schools are the only two STEM designated schools in the entire Upper Cumberland region. I know Cookeville is not as rural as, let's say, like Salina or Gainsboro or Smithville, but still being in a very rural region. Cookeville servicing a lot of rural economies and stuff. Definitely, we wanted to showcase the stories behind these two educators. So we'll have Casey Garrison. She's the assistant principal at Capshaw Elementary School and was the former STEAM teacher at Prescott South Middle. And if you haven't, Mrs. Garrison is amazing to be around. She definitely. And we also have Dr. Catherine Jones, the principal at Prescott South Elementary School, and both of them have been really trailblazers in bringing STEM education to Putnam County. And they've done a great job of especially spreading love for STEAM and among students and even among the community here in Cookeville and beyond. So it will be next Tuesday, October 27th at 3 p.m. So we will have the link posted up on the TAB website, so www.tntech.edu/tab to join. And we would love it for y'all if you could come. If not, then we will have it. We'll post it on YouTube again as well. So does anyone have any questions regarding the speaker series for next week at 3 p.m.? Okay, so just another upcoming thing. So our last meeting of the semester will be Tuesday, November 10th at 11 a.m. So the week after Election Day, we will talk about more news and updates, stuff like that, and hopefully. And so definitely, but we will share a lot of news and announcements within the group me as well. So, please mark that on your calendar. It will be the same Zoom link. And our speaker series as well, this upcoming Tuesday, October 27th at 3 p.m. will be Dr. Jones and Mrs. Garrison. And so not next Tuesday, but we're having one last speaker series of the semester. Tuesday, November 17th at 3 p.m. We'll have Mason Hilliard. He is one of the admissions counselors for West Tennessee here at Tech, and he was the former SGA president a couple of years ago and the former student trustee last year. So Mason is an awesome guy. He's from the county over from me in a small town called Greenfield, right outside of Martin, if you all know where UT Martin's at. And we're still finding our second speaker. We have some people in mind. We're still reaching out to some people, but we will, once we figure that out, we will get that to you. We will share that with you all as soon as possible. So please just keep up on the tab webpage for more details, which will allow you to join the Teams call and to watch just all of these amazing speakers share their rural journeys. And I guess, and again, if you aren't on our email list, please let me know right now, or you can DM me your email, and I will add you to our email list. And if you haven't followed us on Facebook, Instagram, please pull out your phone, pull up your Facebook or Instagram, and just follow us at TNTech RRC, or for the latest news and updates about our club, and at TNTech Rural Reimagined for everything that's going on about the Grand Challenge. So that's pretty much just it for me. Does anyone have any questions or anything before we turn it over to our wonderful speakers? Okay, so I guess it's now time to introduce our speakers for this meeting. So we have Dr. Melissa Geist. She is a professor of nursing here at Tennessee Tech. She is amazing, has done a lot of wonderful things for both the tech community and for the Upper Cumberland community. Has done a lot of great things. And we have Sam LeFave. He is a senior biochemistry pre-med major, as well as the RAM Clinic program lead here at Tech. And so I guess whoever would like to start first, I guess we'll start with Dr. Geist. So if Dr. Geist, I'll stop sharing my screen, but if you could just share with us, kind of your journey, your story, like what you do today, and like opportunities in which any student interested like in nursing or pre-med or stuff like that. Just anything you'd like to share for our members today.
All right. Well, thank you. And thank you for inviting me today to the Rural Reimagined Club. Yeah, I am a professor of nursing with a varied background. My original degrees are in chemistry and physics from the University of Dayton in Ohio. And I taught high school chemistry and physics for many years before I went back to nursing school at Vanderbilt University. And so I am a teacher at Tennessee Tech, but I am also a practicing family and pediatric nurse practitioner. So I worked for 24 years in the emergency room here at Cookeville Regional, and recently transitioned to a set of rural urgent care clinics. And so the mission for the clinics I work for is to provide health access to citizens in rural areas where, as we all know, rural hospitals have closed in several of the counties in the Upper Cumberland. And it's very hard for people to access care, especially primary care. So we're trying to fill that gap. I think in terms of Rural Reimagined, things that I do that I think would be of interest to this group, several things that I'm working on, I'm still waiting for funding, like a lot of things, right? So recently I submitted a grant to the American Nurses Association and Johnson & Johnson, and it is a COVID quickfire challenge. So our proposal, it was my co-researchers, or Dr. Mark Groundland from Spanish Foreign Languages, and Mr. Michael Akins from the Tennessee Center for Rural Innovation. That proposal is called Estar Sano, and so, or Sano, my Spanish is not great, but the whole purpose of that proposal is to mitigate the adverse effects of COVID-19 that's being experienced by our Hispanic population. People don't realize that in the Upper Cumberland region, there are some counties that have up to 12% Hispanic populations. So ESTAR stands for education, support, training, awareness, and resources. And that's what we hope to provide if the grant is funded. The other thing that I've proposed that would certainly impact the Upper Cumberland and have a cross effect with the RAM clinic as well, is GEMS. And so GEMS it's GEMS, like a diamond. And so it's the Golden Eagle Mobile Health Services initiative. And so that would be exactly what it sounds like: a van that is fitted, or an RV that's fitted, to go out into these communities, and using the nurse practitioner faculty, nursing students. We have doctoral nursing students and master's nursing students. They would provide care for those rural populations. So just a little bit about me. If any of those things would come to fruition, boy, would I be coming and knocking on this club's door for help and support for people who are interested. Estar will, I mean, our plan is to be out in the communities, churches, tiendas, so little like local stores that mainly service our Hispanic population, and some of the schools that have higher Hispanic populations in terms of the children who attend. So that will be a huge initiative if it's funded, and I think it'll be an amazing opportunity. And so, all right, I'm going to turn it over to Sam.
Thank you, Dr. Geist. That is exciting to hear about GEMS. I do believe that could be something that pairs well with what we at the remote area medical, I guess the remote area medical group tries to do for this community. As you all have heard from what Dr. Geist had alluded to, we have lost a few of our hospitals in the Upper Cumberland, and as RAM may not be the answer, we hope it is an answer in the meantime. So what remote area medical is a free medical, dental, vision, and other like physical therapy, podiatry, mental health, OT care, counseling service that is mobile and based out of Rockford, Tennessee. It's just outside of Knoxville. We are the host group, the Upper Cumberland Community Host Group, that is responsible for organizing and hosting the clinic at Cookeville each year. We have been fortunate to secure Cookeville High School as a pretty permanent location annually, and are looking to bring the RAM clinic back for March 2021 on March 20th and 21st. So 20th and 21st in 2021 is the next remote area medical clinic at Cookeville High School. We service, as far as Rural Reimagined goes, we service, for the most part, all counties of the 14 counties in the Upper Cumberland. Our patient population radius is within 10 miles from the Cookeville High School, which means even though this clinic is open to anyone, anywhere, we've had people come from Maine and California. The majority of our patients are local. So that just reassures us that we know we have a need in the local area, and being able to partner with Cookeville Regional Medical Center Charitable Foundation as our 501c3 organization, we're able to meet some of those needs by hosting a medical clinic for those who are underinsured or don't have insurance, or even if they do have insurance, they're welcome to come. There are no prerequisites. You don't have to meet any kind of survey as you walk in the door. All we do is get you checked in and get you seen by a provider. So Kester, are there any questions that you have specific to what RAM does, what RAM and the local host group do, or statistics that you might be interested in?
Not really. I want to ask you though, how has RAM helped you as like, a person, as like as a student, as like a leader in the community? And if you haven't know, Sam and I think Dr. Geist they both did a video that was, I saw that on the WCTE Facebook page with some of Tech's faculty and a lot of some medical people around the community. So that was an awesome video that y'all did. So thank you for doing that. So how is
Yeah.
like, but how is
So
like,
Kester,
yeah.
yeah, I got you. So as far as that heart-to-heart message goes, that will be airing again this Thursday. I'm on live at 5. I'll also be on the radio broadcast discussing wearing masks for the most part with our rural population here in the Upper Cumberland. So that is something that's come out of this. An interest to see the needs of some of my neighbors be met has definitely been fostered by working with RAM. I also, though, I will tell you this, RAM has shown me a lot about not only the healthcare, getting healthcare available clinically, but also the business end of things. And I've learned this as a advocate for rural America. Not always can what we see immediately come to pass. So there are steps that we have to take along the way, and you can't get discouraged by that. But if that means you have to readjust your plan and find a new way, then that's what it means. And that has been, I would say, one of the biggest takeaways from working as the host group leader here locally, because again, our resources are not as great as maybe more urbanized or populated area. So an awareness of commitment has come out of working with RAM, as well as working with people. I think your best resources are those who want to volunteer, because people who want to volunteer are willing to come to the table with more than just their time. They're willing to come with ideas. They're willing to come with connections they have, which means resources. So, I think the biggest thing you can do as a rural advocate and someone who's hopeful to see the rural area change is make connections and follow those leads. Does that answer your question, Kester?
Yes, and I'd like to ask if Dr. Geist could come in and just how is working with could you just describe like when you work with students and work with rural people, just like describe like, I don't know what to say, but like I think you know what I mean, because I know, Dr. Geist, you've worked with so many different students and so many different, from whether it be a study abroad to working here and working in the fast pace, like how's just that been, just working with like people here in tech and people within the community as well?
Well, I have to say that certainly, I always say as a practitioner who teaches that, I'm a much better nurse practitioner because I teach, and I'm a much better teacher because I'm a nurse practitioner who works. And so, but yeah, it's, I feel very lucky because I do recruit and travel with students to areas that do not have the modern conveniences that we have. And so, our biggest partner is in Belize, at a village called San Benito Puente, where there's no electricity, there's no running water, there's no clean water. Students that I travel with, we bathe in the river and they use the bathroom in the bush. And the thing is there are rural counties that are the same. So we have people living in the United States in our same area who have outhouses, who are using well water that is contaminated. And so, being in a university that's situated in such a way that we can, in a concentrated way, reach out to those people and work with them. Again, my mantra is, if you're going to be working with communities, you can do three things. You can do things to them, which is the worst possible way to work with a community. You can do things for a community, which is better, or you can do something with a community. And I think one thing at Tennessee Tech, and hopefully with Rural Reimagined, we are always focused on working with these communities. Anything that I do what's called a participatory community assessment, where we figure out their needs coming from them. When I wrote a STAR, the grant, I didn't decide what the Hispanic community needed in this region. We went to them and said, what are your needs? And that's what we put into the grant. And so that's just always been my focus. And for this club, I think that's I think it's the beauty of what we're doing. And you think about Dr. McQuail in rugby, she has those connections, and she has worked with them, and she works with the community to do what's best for them. So anyway.
Thank you so much for sharing that, Dr. Geist. I'm going to turn it over to our members now. Does anyone have any questions for either Dr. Geist or Sam or both? I think Sarah Brown, do you have? I think you told me your wheels were turning a little bit.
Yeah, so firstly, like, this is all like completely down my alley, because like I think I've mentioned before, what actually brought me into this club was in my UNPP class, we are doing we're doing group projects where we're talking about like healthcare needs and how it's affected, like how COVID-19 has affected healthcare in rural areas. But I kind of have a question for Sam. I heard you mention about your RAM that I heard you mention PT, OT, and like mental health. And that's actually kind of like my area of study. I'm a psychology major, but I'm interested in either OT or PT. And I was just curious about like how that works in RAM, because those are sort of areas where you do kind of need like sometimes like a long-term commitment, like to work with people. But I'm just kind of curious about what RAM is doing like in the areas of PT and OT, and also
Sure.
how COVID-19 is affecting that.
Yeah, so COVID-19 obviously is changing our protocols, but I don't think it's going to affect PT and OT. In fact, I don't think it's really going to change what we do at clinic in 2021. The only thing it's going to do is reduce the amount of patient flow that we get. But as far as how PT and OT goes at clinic, normally we recruit local PTs. We may get one or two who are local. The majority of our PTs and OTs are actually students. So we get Bellarmine out of Belmont, that is a big partner with us and has been with us since the beginning, really. And they bring normally about 9 to 10 students for a day to work. And as far as the depth of care that they can do, it is normally diagnostic. As you know, the only thing, the two disciplines that give immediate, I would say, fix to whatever the problem is normally our optometry, which is cutting glasses on day of care, as well as our dental floor, which does a lot of extractions, fillings, some more in-depth oral surgeries, cleanings. So those things we can provide promptly. Our PT and mental health and some OB-GYN, that's more of a get in touch with a provider. And most of those providers come because they want to do more than just business in their clinic. They want to reach out to them outside of clinic at times to make sure they can get follow-up care that's necessary for their health. Is that your question?
You're on mute, Sarah.
Okay, can you hear me now?
I can.
Okay, I'm sorry about that. Yeah, I just want to say thank you for like just explaining all of that, because like even if there's nothing that like we can be directly involved with, it's really good just to have an awareness of what's going on over there, because I think that just kind of connects us with really why we're in this club. So thank you for explaining all of that. I appreciate it.
Yes, and our next RAM meeting is actually this Thursday at 6:30. Yeah, so you can join. The link will be in Teams. So look for that.
Great. Does anyone else have any questions for Sam before we go? I know it's almost noon. I know a lot of y'all have to get to class or somewhere. Anyone else have any last questions? Or anyone have any questions just in general about regarding anything that's going on? Well, I'm going to call this meeting adjourned then. So thank you so much, Sam. And I know Dr. Geist has like hopped off this call, but thank you so much to Sam and Dr. Geist for coming to speak with our students. Please get in touch with either of them. If you're interested in working with either of them or wanting to know more about what they do and stuff like that. So I think Dr. Geist shared her email in the chat, just mgeist, Geist @tntech.edu. And how would someone get in touch with Ram Clinic, Sam, if they wanted to work with y'all?
Just give me an email, sclefave 42 @tntech.edu.
Okay, great. So SCLFA 42 @tntech.edu. So definitely I'll drop that in our group chat actually. So if no one has any questions, well, I'll call this meeting adjourned. So thank you so much, everybody, for coming to this meeting on a beautiful fall day. And if you have any questions, just please let us know. And I hope to see you all at our upcoming Rural Journeys talk at next Tuesday at 3 p.m. So don't miss that. So thank you so much, everybody.